I will begin by introducing my mentor. The colleague in the video is Amanda Burkett. She's an RVT and one of my mentors. Begin with the Schirmer tear test. The Schirmer tear test is a test that is used to test the tear production of the eye. It uses a standardized strip of paper that's calibrated to measure the tear production. The tip of the paper is sterile, so it's important that you do not touch the tip that is going into the eye. The edge of the paper is placed between the lower lid and the cornea, and you want to avoid the medial canthus area. Once in place, the paper is held there for 1 minute or until it's obvious that the animal has adequate tear production. Normal tear production is typically considered 15 to 30 millimeters per 60 seconds. I removed the strip at about at the 30-second mark, as Katie had over 15 millimeters of tear production at that time, and it is documented that she had normal tear production. Next, we'll be testing the eye pressure. To begin, we will apply 1 drop of topical ophthalmic anesthetic to the cornea and wait about 60 seconds for that to take effect before using our tono pen. You want to carefully check your tonometer for make sure it's functioning properly and that it's clean. I've applied a new cover slip to the tip to ensure cleanliness. And then you want to calibrate your machine in according to your manufacturer's recommendation. Our tono pen is pretty old, so it takes sometimes it takes a try or two to properly calibrate it. Once your machine is properly calibrated, you want to make sure that your patient is properly restrained. You want to keep their head and neck in a normal position or as normal as possible. You also want to be careful with your restraint. If you over restrain, it is possible to apply pressure to the eye and get a false reading. This is especially important with your brachiocephalic breeds to be careful and mindful of your restraint during this procedure. Once properly restrained, you want to take your tonometer and very, very gently press it to the cornea. Be very mindful not to apply any undue pressure because you can get a false reading, but you can also cause trauma to the cornea itself. We measured Katie's right eye today, and her measurements were 9 millimeters 9 millimeters mercury and 10 millimeters mercury twice. Typically, we do this exercise 3 times to ensure accuracy, and she had a normal reading. Lastly, we're going to be doing a fluorescein eye stain. This uses a fluorescent dye in the eye. This measures or allows us to see any possible corneal ulcers or damage to the cornea. First, you want to moisten the end of your strip, your fluorescein dye strip, with either sterile eye solution or artificial tear solution, or you can also make a liquid suspension of the dye itself. Once your patient's properly restrained, you want to apply 1 drop to the eye, and then flush out any excess with this eye solution. Once you've flushed the excess dye out of the eye, you want to darken the room that you're in and use some sort of UV or fluorescent light to measure or to examine the eye. Here we're measuring or examining Katie's right eye that we applied this, and there is 0 stain uptake. So this implies a negative eye stain test, and there's no corneal ulcer or damage to report.